E. It is 2:30 a.m. Again, you peel yourself out of bed for the third time tonight, stumbling to the bathroom in the dark.
It is 2:30
Your wife
a.m.
does not even wake up anymore.
You peel yourself
She is
out
used
of
to the
bed for the
routine.
third time
You
tonight,
stand there,
stumbling
waiting,
to the bathroom
willing
in the
your
dark.
bladder to cooperate.
Your wife does not
the
even
stream
wake
is
up
weak,
anymore.
hesitant,
She is used to the routine.
like a garden hose someone
You
is standing
there,
on.
waiting,
Finally,
willing your bladder
after what
to
feels like
cooperate.
forever,
The stream is
you are
weak,
done.
hesitant,
Or are you?
like a garden
Because
hose
20
someone is
minutes
standing
after
on.
you crawl back into bed,
Finally,
the urge
after what
returns.
feels like forever,
And here's the
you
part
are
nobody
done.
talks about.
Or are you?
When your
Because
wife
20
reaches for
minutes
you on
after
Saturday
crawl back
morning,
into bed,
nothing
the
happens.
urge returns.
The
And here's
equipment
the
that
part
used to work
nobody talks
just
about.
fine now
When
feels
your
as
wife reaches for
unreliable
you
as
on
your
Saturday
bladder.
morning,
You tell yourself
nothing
it is
happens.
just age.
The
But what if I
equipment that
told
used to
you
work
these
just
two
fine
problems, the
now
nighttime
feels as
bathroom
unreliable
marathons
as
and
your
the bedroom
bladder?
failures
You tell yourself
are not
it is just
separate
age.
issues?
But what
What
I
if they are
told
two
you these
symptoms
two
of the
problems,
exact
the
same
nighttime
underlying
bathroom
problem?
marathons and the
This is
bedroom
the Health
failures
Span Legends.
are not separate
And today,
issues?
I am
What
going
if
to
they are two
explain
symptoms
why
of the
your pee
exact
problems
same
are
underlying
directly affecting
problem?
your
This is
erections
the Health
and,
Span
more
Legends.
importantly, what
And
you can do
today,
about it.
I am going
Because
to
here is what
explain
most doctors
why
do
your
not
pee
tell you.
problems are
Benign
directly affecting your
prostatic
erections,
hyperplasia,
and more
that is the
importantly,
fancy
what you
term
can
for
do
an
about it.
enlarged
Because
prostate,
here is what most
doubles your
doctors do
risk
not
of
tell you.
erectile dysfunction.
Benign
Not
prostatic
slightly
hyperplasia,
increases it,
that is the
doubles
fancy
it.
term for
A
an enlarged
71-year-old
prostate,
patient of mine was
doubles your
waking
risk
up
of
4
erectile
times every single
dysfunction.
night.
Not
He could not
slightly
play a
increases
full
it,
round of
doubles
golf
it.
without
A
constantly looking
71-year-old
for a
patient of
bathroom.
mine was
And his
waking up
sex
4
life,
times every
non-existent.
single night. He could
After
not
proper
play a
treatment,
full round of
he is
golf
back to
without
sleeping through
constantly
most
looking
nights,
for a bathroom.
playing
And
18
his
holes
sex life,
without interruption,
non-existent.
and
After
yes,
proper
enjoying a
treatment,
normal
he is
sex
back
life
to
again.
sleeping through
So
most
stay
nights,
with me,
playing 18
because in the next
holes
15
without
minutes,
interruption,
I am going to show
and
you
yes,
exactly
enjoying
how
a
your
normal sex
prostate
life
and your
again.
penis are connected,
So stay with
and
me,
what you need to
because
know
in the
to
next
protect
15
both.
minutes I am going to
Let
show
us
you
start with a
exactly
statistic
how
that
your
should get your
prostate and your
attention.
penis are connected.
If you are over 60
and what you need
and
to
dealing
know
with prostate
to protect
issues,
both,
you have a 50-50 chance of also having erectile dysfunction. That is a coin flip. And it gets worse the more severe your urinary symptoms become. A recent study looked at hundreds of men with enlarged prostates. Here is what they found. 36% of men with mild urinary symptoms also had erectile dysfunction. That is already more than 1 in 3. But among men with severe urinary symptoms, the guys who are up multiple times every night, who can barely get a stream going, who dribble afterward, 94% had erectile dysfunction. 94%. That is practically everyone. In fact, having severe lower urinary tract symptoms increases your odds of erectile dysfunction by nearly 29 times compared to men without those symptoms. Let me put that in perspective. If you are struggling to pee, you are almost certainly struggling in the bedroom too. Now, you might be thinking, Doc, I am 65. Is this not just normal aging? And here is where it gets interesting. The research shows that the connection between urinary symptoms and erectile dysfunction is independent of age. That means it is not your age killing your sex life, it is your prostate. 2 different studies confirmed that prostate volume is directly negatively correlated with erectile function. The bigger your prostate gets, the worse your erections become. It is like an inverse relationship. Prostate goes up, erections go down. So here is what you need to understand. Your prostate problems and your erection problems are not 2 separate issues you are unlucky enough to have at the same time. They are the same problem showing up in 2 different places. Your plumbing and your performance share the same wiring. Let me explain the anatomy in a way that actually makes sense. Your prostate is a walnut-sized gland that sits right below your bladder, wrapped around your urethra like a donut around a straw. When you are young, that donut is small and soft, no problem. But after 50, that donut starts growing. By age 60, 70% of men have an enlarged prostate. By 70, it is 80%. As the prostate grows, it squeezes the urethra, making urination difficult. That is the obvious part, the weak stream, the hesitancy, the constant feeling like you need to go. But here is what most men do not realize. The same nerves and blood vessels that control your bladder also control your erections. Think of it like a shared electrical circuit. When one appliance on the circuit malfunctions, it affects everything else plugged into that same circuit. The cavernous nerves, the ones responsible for triggering erections, run right alongside your prostate. When your prostate is inflamed, enlarged, or causing chronic irritation, those nerves get affected too. The blood vessels feeding your penis also travel through the pelvic region, right next to the prostate. When blood flow is restricted to the prostate area due to inflammation or tissue changes, it is also restricted to your erectile tissue. It is not two separate plumbing systems, it is one interconnected network. Sen. Let me break down the 4 main ways your prostate problems directly cause erectile dysfunction. Mechanism 1. Vascular dysfunction. Both benign prostatic hyperplasia and erectile dysfunction share the same root cause: endothelial dysfunction. That is a fancy way of saying your blood vessel linings are not working properly. When the small blood vessels in your pelvis become less responsive, blood flow decreases to both your prostate and your penis. It is like a traffic jam on a highway. When one lane closes, everything backs up. Studies show that markers of poor circulation, like low maximum urine flow rates, directly correlate with worse erectile function. The better your blood flows for urination, the better it flows for erections. Mechanism 2. Nerve damage and irritation. Chronic lower urinary tract symptoms cause persistent stimulation and irritation of the pelvic nerves. Over time, this chronic irritation can damage the nerve pathways responsible for triggering and maintaining erections. Think of it like a phone line with constant static. Eventually, the signal degrades completely. One study found that the severity of urinary symptoms was the strongest predictor of erectile dysfunction, even more than prostate size itself. Mechanism 3. Hormonal and inflammatory factors. Men with enlarged prostates often have lower testosterone levels. In one study, men with severe urinary symptoms had testosterone levels of 286 ngdl, while those with mild symptoms had 544 ngdl. That is almost half the testosterone. Low testosterone directly impacts libido and erectile function. But there is more. Inflammation plays a huge role. Inflammatory markers like TNF-alpha and TGF-beta are elevated in men with BPH, and these same markers predict erectile dysfunction. Inflammation damages blood vessels, reduces nitric oxide production, and impairs smooth muscle relaxation in penile tissue. Mechanism 4. Psychological and sleep disruption. Let us talk about something nobody mentions: the psychological toll. When you are waking up 3 or 4 times every night to pee, you are not getting restorative sleep. Poor sleep tanks your testosterone production. It also kills your energy, mood, and sex drive. One patient told me he was so exhausted from nighttime bathroom trips that sex was the last thing on his mind. And then there is performance anxiety. When you are worried about suddenly needing to pee during intimacy or embarrassed about dribbling afterward, your mind is not in the moment. Anxiety is a proven erection killer. See, here is the number that should wake you up: 94%. That is how many men with severe urinary symptoms also have erectile dysfunction. If you are getting up multiple times every night, if your stream is weak, if you are dribbling afterward, there is a 94% chance your erections are suffering too. That is not a coincidence. It is cause and effect. Let me tell you about a patient who perfectly illustrates this connection. His name was Peter, and he came to see me when he was 71 years old. He had been dealing with prostate issues since his early 60s. At first, it was just getting up once a night, annoying but manageable. By 65, it was twice a night. By 70, he was waking up 4 times every single night. His wife slept in a separate room because he kept disturbing her. But the urinary problems were not the worst part. Peter loved golf. It was his main social activity and exercise. A full round takes about 4.5 hours. He could not make it through without constantly looking for a bathroom. Half the time, he would have to leave mid-round, embarrassed and frustrated. And his sex life. Doc, he told me, I cannot even remember the last time. I am too tired, too anxious, and honestly, even when I want to, nothing works. Peter's primary care doctor had sent him to a urologist years earlier. That urologist recommended a TURP, transurethral resection of the prostate. It is an effective procedure, but it comes with a 20% chance of losing your libido. Peter was terrified of that risk, so he delayed treatment for years. When he finally came to me, we discussed newer, less invasive options. We chose a steam-based treatment called Rezum that has less than a 0.2% chance of affecting sexual function. The procedure went smoothly. Peter had a catheter for a few days and experienced some minor discomfort, nothing he could not handle. Within a few weeks, his flow improved dramatically. It was like someone opened the Hoover Dam, he said. He started sleeping through most of the night, waking up maybe once or twice instead of 4 times. His energy returned, his mood improved, and yes, his sex life came back. At his follow-up 3 months later, Peter told me he had played a full 18 holes without needing the bathroom once, and he and his wife were intimate again. Something he thought was gone forever. "I feel like myself again," he said. That is the power of understanding this connection and treating it properly. So how do you know if your prostate is affecting your erections? Here are the warning signs you need to pay attention to. Urinary symptoms, difficulty starting urination, even when you feel a strong urge. Weak urine stream, it used to be strong, now it is weak and intermittent. Frequent urination, especially at night, more than twice per night is a red flag. Sudden, urgent need to urinate that is hard to control. Dribbling after you finish urinating. Feeling like your bladder is not completely empty. Erectile symptoms. Difficulty achieving or maintaining erections. Erections that are less firm than they used to be. Reduced sexual desire or interest. Morning erections disappearing. Here is the key. If you have both sets of symptoms, they are almost certainly connected. Do not treat them as separate problems. One Reddit user, age 45, started noticing he was waking up 2 to 4 times every night at age 41. Around the same time, his erectile function declined. He did not connect the dots until years later. Another man, age 44, dealt with prostate issues for 10 years, frequent urination, difficulty starting, nocturia. His quality of life was destroyed, and his sexual function suffered alongside it. Woo. Here is the good news. There is one medication that can treat both problems at the same time. It improves urination and erections with one daily pill. I will tell you exactly what it is in just a moment. But first, we need to talk about a huge problem in how BPH is typically treated. Many doctors prescribe medications called 5-alpha reductase inhibitors, drugs like finasteride or dutasteride. These medications shrink the prostate by blocking testosterone conversion. And yes, they work for urinary symptoms. But here is what they do not tell you. These medications significantly increase erectile dysfunction and decrease testosterone levels. In some studies, men taking dutasteride experienced worsening erectile function and mood disorders. The drugs that are supposed to help your prostate can actively harm your sexual function. Then there is surgery. Traditional procedures like TURP, transurethral resection of the prostate, can damage the nerves running alongside the prostate. The incidence of erectile dysfunction after TURP can reach 40%. That is 4 out of every 10 men losing erectile function from the surgery meant to help them. Even some minimally invasive procedures can inadvertently affect the cavernous nerves essential for erections. So here is the dilemma. You need to treat your prostate to protect your erections, but some treatments for your prostate can destroy your erections. That is why choosing the right treatment is absolutely critical. And here is the hidden trap most men fall into. Some of the most commonly prescribed BPH medications are secretly killing your erections. Your doctor might not even mention this side effect, but it is real, it is significant, and it is reversible if you know what to look for. So what can you actually do to protect both your prostate health and your sexual function? Let me give you practical, evidence-based strategies. Strategy 1. Consider Tadalafil Cialis as a first-line treatment. Tadalafil is the only medication approved by the FDA to treat both erectile dysfunction and lower urinary tract symptoms from BPH. It works by increasing blood flow to both the prostate and the penis. Studies show that men taking Tadalafil daily experience improvements in both urinary symptoms and erectile function. In one large study, men taking Tadalafil had better outcomes, higher treatment adherence, and less healthcare resource use compared to men on other BPH medications. The typical dose is 5 mg once daily. It is especially effective for younger men with more severe urinary symptoms. And unlike 5-alpha reductase inhibitors, Tadalafil does not lower your testosterone or worsen erectile function. It improves it. Strategy 2. Combination therapy for severe cases. For men with both significant urinary symptoms and erectile dysfunction, combining Tadalafil with an alpha blocker like tamsulosin provides superior results. The combination improves symptom scores, urinary flow rates, and sexual function better than either medication alone. This approach is especially helpful for men who also have diabetes or hypertension. Strategy 3. Choose the right surgical approach if needed. If medication is not enough and you need a procedure, ask about newer techniques that preserve sexual function. Blue laser vaporization and robotic water jet ablation, aquablation, have significantly lower rates of sexual dysfunction compared to traditional TURP. Rezum water vapor therapy preserves sexual function in over 99% of cases. The UroLift system mechanically opens the urethra without cutting tissue, preserving sexual function. Always ask your urologist, what is the risk to my sexual function with this procedure? If they cannot give you a clear answer, find another urologist. Strategy 4. Lifestyle modifications that help both. Maintain a healthy weight. Obesity worsens both BPH and ED. Regular exercise improves blood flow to the entire pelvic region. Manage blood sugar. If you have diabetes, high blood sugar damages the nerves and vessels, affecting both urination and erections. Limit caffeine and alcohol in the evening to reduce nighttime urination. Better sleep means better testosterone production. And here is what you can expect. Within 2 to 4 weeks of starting the right treatment, most men notice improvements in both urination and erectile function. You will sleep better, pee better, and perform better. All three are connected. So when should you actually see a doctor about this? Here are the red flags that mean you need help now. Seek immediate medical attention if you cannot urinate at all. This is a medical emergency. You see blood in your urine. You have severe pain in your lower abdomen or pelvis. Schedule an appointment soon. If you are waking up more than twice per night to urinate, your urine stream is significantly weaker than it used to be. You are experiencing both urinary symptoms and erectile dysfunction. Your symptoms are affecting your quality of life. You are avoiding social activities, travel, or intimacy because of urinary issues. You are over 50 and have not had a prostate exam in the past year. Do not wait until symptoms become severe. Remember, 94% of men with severe urinary symptoms have erectile dysfunction. Early intervention protects both your urinary function and your sexual function.
6. Let me take you back to Peter, the 71-year-old golfer. For nearly a decade, he watched his quality of life slowly deteriorate. 4 times every night, he would stumble to the bathroom. He could not enjoy his favorite hobby without constant interruptions. And his sex life disappeared entirely. He thought it was just aging, something he had to accept. But it was not aging. It was an enlarged prostate affecting everything connected to it. After proper treatment, Peter got his life back. His urination improved so dramatically he described it as opening a dam. He sleeps through most nights now. He plays full rounds of golf without interruption. And yes, he and his wife are intimate again, something he had given up hope on. I feel like myself again, he told me. That is what proper treatment can do when you understand the connection. Your prostate and your penis are not separate systems, they are parts of the same interconnected network. When one suffers, the other suffers too. But the good news is, when you treat one properly, you often improve both. Here is what I want you to do today. If you are experiencing frequent nighttime urination and erectile difficulties, do not treat them as separate issues. Make an appointment with a urologist who understands the connection. Ask specifically about Tadalafil and other treatments that address both problems. And if you are over 60 and have not had a prostate exam recently, schedule one. Early detection and treatment prevent both problems from getting worse. Important medical disclaimer. This video provides general educational information based on published medical research, not personalized medical advice. If you are experiencing severe urinary symptoms or erectile dysfunction, consult a qualified healthcare provider for proper evaluation and treatment. Some treatments for BPH carry risks to sexual function. Always discuss these risks with your doctor before starting any medication or procedure. Your prostate health and your sexual health are connected. Protect one, and you protect the other. Thanks for watching. Now go schedule that appointment.